Hello, hello everybody. I'm Dr. Sunanda Chava. I'm a specialist in oral medicine and radiology. Today I would like to talk about diabetes insipidus. So what is diabetes? Diabetes means passing urine with legs apart. It could be diabetes insipidus or diabetes mellitus. So in diabetes mellitus you have sweet urine, you have increased blood glucose levels. In diabetes insipidus you have a diluted urine and large amount of urine also produced as in diabetes mellitus. So in diabetes insipidus, there is deficiency of antidiuretic hormone. In diabetes mellitus, there is deficiency of insulin, which is secreted by beta cells of pancreas. So you'll have sweet urine, you have lot of urine production also. In both diabetes insipidus and in both diabetes mellitus, you will have polyuria, polydipsia, that is excess urine production, excess thirst. But in diabetes mellitus, you have sweet urine, that is glucose levels are more, whereas in diabetes insipidus, it could be normal. So next is, so as we know, the diabetes insipidus is caused by deficiency of antidiuretic hormone, also called vasopressin. So antidiuretic hormone is the other name for vasopressin. So they are produced by hypothalamus and they are stored in the pituitary gland and they are released when needed. So this antidiuretic hormone, it prevents water loss in urine through urine. Therefore, it concentrates urine. So antidiuretic hormone, diuresis, anti. So it produces less urine. So it prevents the loss of water or fluid from the body through the urine. So in antidiuretic hormone, you have if there is deficiency, you have large amount of urine production. So fluid is lost. So you have signs of dehydration. So features of diabetes insipidus, you have polyuria, that is passing urine more. Usually you say polyuria when a person passes more than 8 times per day and when he gets up for more than one time in the night time to pass urine. So then you say it is polyuria generally. Then the patient of diabetes insipidus, there will be polydipsia also, means patient will have lot of thirst because lot of water is being lost in urine. There is dehydration. They'll have thirst sensation more and the patient will not feel like having food, that is anorexia. These three features are seen in case of diabetes insipidus. So what are the types of diabetes insipidus? There are 4 types of diabetes insipidus. So first one is central or cranial diabetes insipidus. Second one is nephrogenic diabetes insipidus. Third one is dipsogenic diabetes insipidus. Fourth one is gestational diabetes insipidus. So this deficiency of antidiuretic hormone, it usually causes a type of diabetes insipidus called cranial or central. So the causes could be surgery, infection, inflammation, tumor, head injury, inherited defect in gene related to vasopressin. So these are the causes for cranial diabetes insipidus. In nephrogenic diabetes insipidus, kidneys fail to respond to antidiuretic hormone. So the causes could be, it is in few cases it's unknown cause. Other causes of nephrogenic diabetes insipidus is chronic kidney disease, lithium, low potassium levels in blood, then high calcium levels in the blood, and also the blockage of the urinary tract. So the third type of diabetes insipidus is called dipsogenic. As you have Pepsi like that, you can remember by the term Pepsi to drink like that. Dipsogenic diabetes insipidus, the thirst is sensation is more seen in these patients. The thirst center is in hypothalamus, that is affected in dipsogenic diabetes insipidus. Patient will drink more water and pass more urine. Causes are similar to that as seen in case of cranial diabetes insipidus. So fourth one is gestational diabetes in the insipidus. As we know, gestation means pregnancy. So here what happens in a pregnant lady, the placenta which connects the mother and baby, it breaks down the mother's vasopressin. So in some other cases, pregnant women will produce hormone like chemical prostaglandin, or it could be cysteine aminopeptidase, which makes the kidneys refractory to vasopressin. So complications of diabetes insipidus means are dehydration due to loss of water from body, polyuria, diluted, colorless, odorless urine, thirst, dry skin, fatigability, sluggishness, dizziness, confusion, nausea, seizures. So in seizures means in the dental chair, the patient might have seizures. So you have to think about diabetes insipidus also when the patient is on chair. Permanent brain damage, sodium gets accumulated, death also, coma, death, sodium gets accumulated in blood and causes complication. So constipation, this could be due to high calcium levels, weak muscles, bedwetting and children. Okay. Now diagnosis of diabetes insipidus, this could be by medical and family history. You're going to take medical and family history detail. Is anybody, any other member in your house having this problem? So the patient might have dry mouth also. Okay. Physical examination, checking for signs of dehydration like skin appearance. Next is urine analysis. See for dilution or concentration. See for glucose levels. And a urinary specific gravity of 1.005 or less, and urinary osmolality of less than 200 200 milliosmoles per kg water is hallmark of diabetes insipidus. So, and also you can measure 24-hour urine amount. And another blood test you see is measure sodium levels. So you're going to do blood test to measure the sodium levels, and you're going to do something called as fluid deprivation test. So you have two types of fluid deprivation test, that is short form and formal one. In the short fluid deprivation test, you have the patient is stopped taking or drinking fluids for a specific period of time, usually during a dinner. Next morning, the patient will get up and the urine sample is collected and its concentration is measured. So then another is another variant of fluid deprivation test is formal fluid deprivation test. So the patient is weighed and urine sample analyzed. It is repeated several times, and the anesthesia in this case is not needed. Patient's blood pressure is measured every 1 to 2 hours until it drops too low. Heartbeat increases on standing. Weight is lost by 5%. Urine concentration increases slightly in 2 or 3 consecutive measurements. Means blood pressure is measured every 1 to 2 hours. Then after that, until it drops to too low, blood BP is reduced too low, and you measure until the heartbeat increases on standing, and then you see until the weight is lost by 5%. You see the urine concentration, which increases slightly in 2 or 3 consecutive measurements. Till then, you are supposed to measure all these parameters. Then at the end of the test, blood sodium, vasopressin levels, urine concentration are also measured. And another point in diagnosis of diabetes insipidus is MRI. It doesn't show anything regarding diabetes insipidus, but it just tells us. It uses magnetic field to scan the head and neck, and so head region. So you see if there's any problem in hypothalamus or pituitary gland in MRI. It's a non-invasive technique. It's a the non-ionizing radiation, that's a magnetic field, is used for this MRI. So you see for the problem in hypothalamus and pituitary gland. So coming to treatment. In the central or cranial diabetes insipidus, desmopressin as a spray, injection or tablet given for signs and symptoms, but can be given for alleviating the signs and symptoms, but it does not cure diabetes insipidus. So coming to nephrogenic diabetes insipidus, you can change the medications. So you can maintain the blood calcium and potassium levels. Then you can also give thiazide diuretics, which decrease the urine production, and also they concentrate urine paradoxically in nephrogenic diabetes insipidus. Aspirin and ibuprofen can be combined with thiazide diuretics, and ibuprofen reduce the urine volume. So in dipsogenic diabetes insipidus, sucking ice tips, sour candies to moisten the mouth and reduce water intake. So desmopressin is in small doses can be given. So because they'll be having lot of thirst, they'll be drinking more water. To prevent that, you can give ice tips to suck, and you can also use sour candies you can taste. So that will moisten the mouth, but and this will reduce the less sensation taste thirst sensation, so they won't drink more fluids. Gestational diabetes insipidus, desmoprotein is not destroyed in pregnancy, so that can be given in the gestational diabetes insipidus. It usually disappears once a child is born, but it might occur again when the second child is born. So usually the condition disappears after childbirth. Okay, thank you for National Institute of Diabetes and Digestive and Kidney Diseases, Wikipedia and all. So I referred these articles to collect this material. Okay, thank you. Goodbye, all of you. Meet you in the next video.